1. In the AMLS primary assessment, which of the following findings would most strongly suggest the need for immediate airway intervention? A. Respiratory rate of 22 breaths per minute. B. Pulse oximetry of 94% on room air. C. Gurgling sounds with incomplete sentences. D. Mild inspiratory wheezing. 2. When teaching AMLS learners about differentiating shock types, which instructional method best aligns with adult learning principles? A. Reading directly from the textbook. B. Group case-based scenario discussion. C. Multiple choice quiz immediately after lecture. D. Instructor-only demonstration. 3. A patient presents with crushing chest pain and diaphoresis. According to AMLS algorithms, what is the most appropriate first action after scene safety and BSI? A. Administer nitroglycerin. B. Obtain a detailed history. C. Apply oxygen and attach cardiac monitor. Start CPR immediately. For during evaluation in AMLS, which approach best determines the learner's ability to apply knowledge? A. Written test. Simulation-based scenario evaluation. C. True or false quiz. D. Oral presentation on theory. 5. In the AMLS secondary assessment, which step should be performed first after ensuring airway, breathing, and circulation are stable? A. Focused history sample. B. Head-to-toe assessment. C. Obtain vital signs. Reassess airway. 6. When designing an AMLS curriculum for paramedics, what is the best way to enhance retention and skill performance? A. Provide lengthy PowerPoint lectures. B. Incorporate repetitive hands-on simulation. C. Focus solely on written tests. D. Use passive video-based learning. 7. A patient with severe respiratory distress has absent breath sounds on the left and JVD. What is the most likely diagnosis? A. Pulmonary embolism. B. Tension pneumothorax. Cardiac tamponade. D. Asthma exacerbation. 8. According to adult learning theory, the AMLS instructor should primarily act as A. Sole authority and evaluator. B. Knowledge facilitator and guide. C. Passive observer of learning. D. Enforcer of rigid curriculum rules. 9. A patient presents with altered mental status, tachypnea, and fruity odor on breath. What AMLS differential should be prioritized? A. B. DK8 ketoacidosis. C. Narcotic overdose. D. Stroke. 10. What is the most effective feedback technique for mentoring AMLS students after simulation errors? A. Publicly correcting the error. B. Providing immediate, private, constructive feedback. C. Waiting until final evaluation to mention errors. D. Ignoring minor mistakes. 11. Which of the following accurately reflects AMLS protocol for suspected sepsis? A. Start antibiotics before fluids. B. Rapid transport after initial stabilization and IV fluid bolus. C. Delay transport until BP stabilizes. D. Focus only on airway management. 12. When evaluating AMLS learners' critical thinking, what type of assessment tool is most suitable? A. Multiple choice recall test. B. Scenario-based performance rubric. C. Fill in the blank worksheet. D. Matching terms exercise. 13. What is the correct order of the AMLS assessment process? A. Scene size up, primary, secondary, ongoing. Secondary, primary, triage, reassessment. C. Scene size up, secondary, ongoing. D. History, scene size up, reassessment, primary. 14. In the AMLS framework, which patient presentation best exemplifies distributive shock? A. Blood loss from trauma. B. Spinal cord injury with hypotension. C. Myocardial infarction. Pulmonary embolism. 15. Which educational strategy promotes self-directed learning in AMLS participants? A. Guided case review with self-assessment forms. Mandatory memorization sessions. C. Instructor-only lectures. D. Timed written test. 16. A patient's ECG shows wide QRS, hypotension, and irregular rhythm. Which treatment aligns with AMLS protocol? A. Synchronized cardioversion. Only. Rabbit dextrose. D. Trendelenburg position. 17. In developing an AMLS course, which element ensures regulatory compliance? A. Ignoring updates to national guidelines. B. Aligning curriculum with named standards and documentation. Using outdated protocols. D. Omitting post-course evaluations. A 55-year-old patient with abdominal pain has BP 8654, HR 122, and pale, clammy skin. Which action should come first? Transport to surgery. B. Establish I4 access and administer fluids. Obtain detailed history. D. Perform 12-lead ECG. 19. Which mentoring approach best enhances AMLS learner confidence and performance? A. Encouraging reflection and peer discussion. B. Strict grading without feedback. C. Isolating weaker learners. D. Relying only on summative assessment. 20. During AMLS training, a learner consistently struggles with differential diagnosis. The instructor should A. Review the entire lecture again. B. Provide targeted coaching and guided reflection. C. Deduct points for poor performance. D. Move on to the next module. 21. In advanced medical life support, which type of shock results from a massive pulmonary embolism obstructing blood flow to the lungs? Hypovolemic shock. Cardiogenic shock. C. Obstructive shock. D. Neurogenic shock. 22. When evaluating an advanced medical life support learner's performance during a simulation, which type of assessment provides ongoing feedback and guides skill improvement? A. Summative evaluation. B. Formative evaluation. C. Peer evaluation. D. Written test assessment. 23. When assessing learners' AMLS performance, formative evaluation is best used to A. Determine final course grade. B. Provide ongoing feedback and skill correction. C. Replace summative assessment. D. Measure course completion only. 24. Which symptom best differentiates cardiogenic shock from hypovolemic shock in AMLS evaluation? Dry mucous membranes. B. Jugular venous distension. Pale cool skin. Rapid weak pulse. 25. What is the most important element in developing an AMLS case scenario? A. Matching real-world complexity and relevance. B. Including unnecessary medical jargon. C. Limiting learner participation. Focusing on one body system only. 26. In advanced medical life support, which clinical sign best distinguishes cardiogenic shock from hypovolemic shock? Flat neck veins. B. Jugular venous distension. Warm flushed skin. D. Absence of peripheral edema. 27. What is the role of communication in AMLS team-based decision-making? A. Enhances collaboration and reduces error. B. Slows down decision-making. C. Is secondary to individual judgment. D. Is optional during critical care. 28. When conducting post-simulation debriefs in AMLS, what is the primary goal? A. Identify mistakes and assign blame. B. Promote reflective learning and self-assessment. Test factual recall. D. Evaluate written test results. 29. In the context of AMLS, the term clinical reasoning refers to A. Memorizing treatment steps. B. Analyzing patient data to form differential diagnoses. C. Recording vital signs. D. Following checklists without judgment. 30. Which instructional tool provides the highest engagement for AMLS students? A. Interactive simulation with feedback. B. Slide presentations only. C. Audio lectures. D. Paper worksheets. 31. In the context of advanced medical life support, what is the primary goal of conducting a debrief after a simulation exercise? A. To assign grades and scores to learners. B. To identify individual blame for errors. C. To promote reflective learning and self-assessment. To repeat the same scenario for memorization. 32. What documentation standard supports AMLS legal compliance? A. Accurate, timely, and objective patient care reports. B. Abbreviated notes for rapid completion. C. Delayed entries after shift. D. Subjective impressions. 33. An AMLS instructor incorporates role play during class. This method primarily supports A. Experiential learning. B. Rote memorization. C. Lecture-based delivery. D. PAV observation. 34. A patient presents with fever, tachycardia, and hypotension following a urinary tract infection. Which treatment aligns with AMLS priorities? A. Oxygen, fluids, and early transport. B. Immediate antibiotics only. C. Wait for lab results before treatment. D. Airway management only. 35. Which regulatory standard governs AMLS content updates and instructional delivery? A. And national EMS educational standards. B. Local instructor preferences. C. Student polling results. D. Individual agency policies only. 36. AMLS emphasizes treat the patient, not the monitor. This principle highlights the importance of A. Clinical judgment and holistic assessment. B. Technology over observation. C. Following algorithms only. D. Ignoring patient complaints. 37. In mentoring new AMLS instructors, what practice best ensures consistency in evaluation? A. Using standardized performance rubrics. B. Allowing individual grading interpretations. C. Ignoring national criteria. Relying on peer opinions.